Hello friends, so welcome to my channel again. Today we are going to discuss a short topic about the urinary bladder innovation. So what are the nerve supplies of the urinary bladder? Let's jump into the topic straight away. So to start with, the urinary bladder has basically the three peripheral nerves. The three peripheral nerves are supplying the urinary bladder. Now what are they? Number one is the pelvic parasympathetic nerve supply, the pelvic parasympathetic nerves, and these nerves have the root value from S2 to S4, that is the sacral segments. These sacral segments supply the urinary bladder. So let us understand this, that for example here is S1 to S4, the nerve supply. These nerves they go and land up in the pelvic ganglion. So this is the pelvic ganglion, and from here the nerves relay to the urinary bladder. Now in the urinary bladder, if we have to draw that, so this is the bladder and this is the urethra. In the urinary bladder there are different receptors. In the bladder there are the muscarinic receptors M3 and M2. Now and the what we can say, the neurotransmitter over here is acetylcholine, and the other supply is from the nitric oxide, which supplies the urethra part, and this urethra is mediated by the cyclic GMP. Now whenever the parasympathetic nerve supply fires, it goes toward from S2 to S4 and it supplies the acetylcholine to the muscarinic receptors, which ultimately leads to bladder contraction, right? Bladder contraction, and the urethra get relaxed. That means the urination occurs, right? So this is the first supply. Coming to the second part, the second nerve supply is the lumbar sympathetic nerves. The lumbar sympathetic nerves. These nerves, they generally originate from the thoracolumbar outflow. We know that the sympathetic outflow is the thoracolumbar. So if we have to draw it, then we can draw it in this fashion, like from T11 to L2. This is the root value for that. Now these nerves, they originate from the thoracolumbar outflow. They get relayed into a ganglion, and this ganglion is named inferior mesenteric ganglion. The inferior mesenteric ganglion. This is the inferior mesenteric ganglion. Now these nerves now relay to the bladder and to the urethra. For example, this is the bladder, this is the urethra. Now here there are certain receptors which are known as beta 2 and beta 3 receptors, and here in the urethra part there is alpha 1A receptor. Now what is the function of this? Whenever this T11 to L2 fires, it has the sympathetic innervation, and what it causes the bladder to get relaxed. The bladder gets relaxed, and the urethra, it gets contracted. That means there is no urine outflow. That means there is no urine outflow. The urine gets stored in the bladder, right? So these are the two nerve supplies. Now coming to the third part. Third is the pudendal nerve, which is having the somatic supply or the somatic pathway of the nerves. Somatic pathway of the nerves. Now what does it does? Now to describe it, the pudendal nerve, it also starts from S2 to S4 along with the parasympathetic nerves, S2 to S4 region. These nerves originate, they do not lie any in the ganglion, they directly innervate the different muscle groups, that is external the external sphincter, that is the striated muscles. This is the striated muscles. Now this has different receptors that are called as nicotinic receptors. Nicotinic receptors. Now these receptors, when the pudendal nerve via the somatic pathway it fires, it releases the acetylcholine. And when it fires, it makes the urethra to contract, right? So these are basically the three peripheral nerves, or we can say the nerve supply. We can say that nerve supply to urethra and bladder, to urethra and bladder. So these are the vital structures in the urinary bladder to control, and most of the medications are being given keeping in mind the supply, and there are the different kinds of the bladder. We'll discuss it in our next video. So if you like the video, please subscribe to my channel and hit the like button, and please do comment what are your feedbacks and what kind of videos do you want. Thank you from my side.